I'm a medical doctor, and today I'm breaking down what the new ChatGPT HEALTH actually means for mental health care, what some of the recently released OpenAI data shows us, and most importantly, how I am responding to this major update as a medical doctor myself. Now, this is one of those health updates that you really need to understand because it very well might change how we all experience medicine. And this entire topic landed on my head recently when OpenAI released data showing that 40 million people are reportedly asking ChatGPT HEALTH questions every single day. And no, you didn't hear that wrong. That's 40 million daily users asking about symptoms, medications, insurance, when to go to the ER, and so forth. They also found that about 5% of all ChatGPT messages globally are about healthcare, which means that since you've been watching this video, millions or maybe even billions of healthcare questions have been posed to chatbots like ChatGPT. And I can almost guarantee you that several of your friends, family members, or even yourself could be among those people. Now, if you're new here, I'm Dr. Joseph, also known as Dr. J, and I'm a medical doctor specializing in psychiatry, and I make mental health make sense for you. Now, before we go any further, I want to be super clear about my perspective on this. I'm not here to tell you that AI is going to replace doctors. That's not happening, at least not anytime soon anyway. I'm also not here to fearmonger people into using technology to understand your health. What I am trying to do, in fact, is to help us navigate this new reality with our eyes wide open. Because whether we like it or not, AI is already part of the healthcare conversation. And for mental health specifically, the implications are incredibly massive. Okay, so our first point is about the sheer scale of what's happening. And I don't think most people, including many doctors like myself, realize how big this is already. So according to OpenAI's own data from January 2026, more than 5% of all ChatGPT messages globally are healthcare related, which works out to billions of messages every single week. They also shared that 1 out of 4 ChatGPT users submits a healthcare prompt weekly. These are wild numbers. So let me put that in perspective for you. 40 million daily users is more than the entire population of California. It's also roughly the population of the entire country of Spain. And every day, that many people are turning to AI for health information. I want you to think about that for a second. So most people, including myself, are very interested in the mental health side of things. So you might be thinking, okay, but how many of those questions are mental health related? Well, we don't know the exact numbers broken down by specialty, but think about this. Mental health conditions are among the most common reasons people seek healthcare. Depression, anxiety, ADHD, insomnia, relationship issues. These aren't rare conditions. They are the things people deal with every single day. So I suspect that they are likely heavily represented in this millions and billions of inquiries. Now, personally, in my psychiatry practice, I often see patients are coming in already having researched their symptoms. They've asked AI if what they're experiencing is depression or burnout. They've looked up medication side effects, they've prepared questions for me, and for most patients, they are not even mentioning any of this unless I specifically ask them about this. Which brings me to the uncomfortable truth. A lot of patients are already using AI for mental health information. And the question isn't whether they should or shouldn't. The question, I think, is how do us medical professionals respond when they do? Our second point is one that really stopped me in my tracks, and that is 70% of healthcare conversations in ChatGPT happen outside of normal clinical hours. Think about that for a second. That is 70%, which means most people are asking health questions when clinics are closed. So between 5 p.m. and 8 a.m. on weekends, during holidays, things like that. And for mental health specifically, this matters enormously because panic attacks don't wait for business hours, and suicidal ideation doesn't check clinic schedules, and medication side effects have no problem showing up at 11 p.m. when the pharmacy is closed to questions. So let me walk you through a real example from the OpenAI report. Now, a woman named Irene Santoso was living in San Francisco, and her mother was in Indonesia, but then her mother started experiencing sudden vision loss, and the family initially thought this was fatigue, but Santoso wasn't convinced. So at whatever hour it was, probably middle of the night given the time zones, she entered her mother's symptoms into ChatGPT along with prior medical history and some more context. Now, ChatGPT gave her a clear warning. This could be a sign of a hypertensive crisis, maybe even a stroke. Get her blood pressure checked immediately. Now, when they checked the blood pressure, it was dangerously high, so she went to the hospital, and there they confirmed that she had an hypertensive crisis and received treatment. Now, she ultimately recovered most of her vision back, which was obviously a huge outcome for the family. Now, let's translate this to a mental health issue with two different outcomes. I want you to picture someone experiencing their very first panic attack at some point around 2 a.m. Now their heart's racing, they can't breathe, they're having chest pain, they're convinced they're dying, but they can't call their therapist because of how late it is. And the emergency room feels like overkill for just anxiety. So they ask ChatGPT, am I having a heart attack or a panic attack? Now what happens next matters, because that AI response might help them recognize panic symptoms, help them figure out a practice, grounding techniques, and understand that they're ultimately safe. Or it might miss something serious and tell them not to worry when they actually need emergency care. Now, I want to be really clear here. AI is not a replacement for crisis intervention. It's not a substitute for 988 or the ER services, but it is becoming a de facto triage system when nothing else is available. And we need to understand that reality. Now, the 70% of outside clinic hour statistic tells us something really important. It tells us that people need health support when the system isn't available, and they're finding ways to get that any way they can. Our third point is about something that genuinely creates mental health symptoms in patients, and that is health insurance. I know, I kid you not, that is not a joke. It's really intense. Now, nearly 2 million ChatGPT messages per week are reportedly about health insurance. So comparing plans, understanding prices, handling claims and billing, figuring out coverages, and dealing with denials. Think about that for a second. 2 million messages every single week about insurance. That's more people than live in Phoenix, Arizona, just trying to understand their healthcare coverage. And for mental health, this is especially brutal because mental health services have some of the highest insurance denial rates of all of medicine. Prior authorizations for psychiatric medications can take weeks and weeks, and therapy sessions get capped at arbitrary numbers throughout the year. What this means is the administrative burden is crushing. Now, imagine AI support for insurance-related issues in mental health. Prior authorization gets denied for your patient's ADHD medication. Maybe they could use AI to find support and evidence. Now, let's say insurance is refusing to cover TMS therapy for treatment-resistant depression. Well, how about we find a literature review through an AI that might help the appeal process? Or let's say a patient is confused about their mental health benefits. An AI could help them translate the insurance jargon and help keep them more informed. Now, I know what you're thinking, and yes, AI can help people fight through the bureaucracy. The real solution is really fixing the system that creates the barriers in the first place. But it's reality to understand the current constraints and solve what we can as we try to make a greater difference. Our fourth point is about access, and specifically about what happens when there is no access at all. The OpenAI data analyze what they call hospital deserts, and these are locations that are more than 30 minutes of a driving distance from the nearest general, medical, or children's hospital. And in these deserts, ChatGPT users are sending nearly 600,000 healthcare-related messages every single week. Now, Wyoming, which is the least populated state in America, reportedly has the highest rates of healthcare AI messages from hospital deserts nationwide. Oregon is second, Montana is third, and South Dakota is fourth. Now, think about what this means. It means that in Wyoming, you're statistically more likely to encounter a grizzly bear than a psychiatrist. So when someone's depression spirals, when anxiety becomes unbearable, when they're having intrusive thoughts and need help, they're asking ChatGPT because there's almost nothing else accessible to them. Now, it's estimated that about 10 rural hospitals close every year in the US, and nearly half of all rural hospitals operate with negative margins, and more than 400 of these hospitals across 38 states are considered vulnerable to closure. Now, AI won't reopen a shuttered hospital. It won't restore a discontinued psych unit or replace critical services. But in the near term, it can help people in underserved areas interpret information and prepare for care when they can finally access it. AI is de facto becoming the stopgap in the system when it fails. It's not ideal, but again, it's reality. Okay, our fifth point might surprise you, and that is doctors are already using AI. You just don't know it yet. Now, per OpenAI, 6% of American physicians now use AI for at least one case at work. That's up from 38% just 1 year ago. And that's a 28% jump in 1 year. Now here's where it gets really interesting for mental health. When physicians were asked what AI helps with the most, 75% said work efficiency, 72% said diagnostic ability. But the biggest jumps in perceived helpfulness from 2023 to 24 was managing stress and offering personalized care. Let that sink in. Doctors are using AI to manage their own stress. And if you know anything about physician burnout, especially in psychiatry, you know why this matters. Psychiatric documentation is notoriously time-consuming. I mean, you're talking treatment plans, risk assessments, prior authorizations, disability paperwork. The administrative burden can feel soul-crushing. So when 75% of physicians say AI helps with efficiency, yeah, what they're really saying is, this tool gives me back time for patient care, time for thinking, time for the actual work that I went into medicine to do. And also, if 2/3 of doctors are already using AI, then we should be learning from each other. So sharing what works, warning each other about what doesn't work, and building a collaborative approach to these tools. Because at the end of the day, it's not about replacing clinical judgment. It's about reducing the administrative work that drives good clinicians out of practice. And trust me, I see this every single day in healthcare today. Our final point is about what happens next. Because ready or not, this conversation about AI in healthcare has landed, and it's going to affect all of our lives, both as doctors and patients, for a very long time. And which means that my patients might walk into my office next time and saying, "Hey doc, I consulted with ChatGPT and this is what I found." Or they might say, "I looked up my symptoms and this is what I found." Or they might ask me if their medication interacts with a supplement, but they already asked ChatGPT before they saw me. Now, I truly believe that what I say as a doctor can either build trust or destroy it with my patient. So I'll give you an example of real life scenarios and two outcomes. The first response that I could have is, "Hey, you shouldn't be doing that because Dr. Google is dangerous and you can't trust AI." And that's it, I shut up. I want you to compare this to a second response, okay? "Hey, so I'm glad that you're researching your health and preparing for our appointment. Let's look at what you found together and I'll add my clinical perspective based on my examination of you." Now, do you see that difference? One response shut down the entire conversation and created shame. It positioned the doctor as the gatekeeper of information, while the other response opened up a dialogue. It validated the patient's engagement and positions the provider as the expert interpreter who can contextualize what they found. So in my personal practice, here's what I do when it comes to patients and AI research. First, I ask proactively, something like, "Hey, have you looked up any of the symptoms online or asked AI about them?" I don't wait for people to confess or, kind of just expose it themselves. You just normalize it, make it part of your standard assessment. Second thing I do is I review together. I look at what they found, I correct the misinformation gently, and I build on the accurate parts. I often see it as a teaching opportunity, and honestly, patients really appreciate this. Third thing I do is I set boundaries. I make it known and clear that AI is great for information, but it can't examine you or prescribe you medications or provide therapy. That's where we work together as a team. And the fourth thing I do is I document it. I notice in the charts when patients bring up AI-generated questions or concerns. This protects me or you medical legally and helps with continuity of care. For whoever picks up the patient the next time or picks up their management, they can know where I left off, both in my discussions and in my future plans. Honestly, my prediction for the future is AI-informed patients working with AI-assisted clinicians to lead to better outcomes through collaboration. Now, the patients might bring in questions and research, while the clinician brings in examination, diagnosis, treatment expertise, and building a trusting relationship. This collaboration, I believe, is more powerful than either units working by themselves. So through these 6 points, my question isn't whether we embrace or reject AI in mental health care and medicine in general. The question I want us to address is, how do we use these tools to enhance the current healthcare system, especially while maintaining the human connection that makes healing possible? Now, I want you to make sure to drop your thoughts in the comments below because I'll be responding to every single one. Now, if this video added some value to you as to how AI is changing healthcare, then make sure to subscribe for more insightful health videos like this in the future. I also think you will like my latest video, linked right here. I'm Dr. Joseph, and I'll see you on the next video. Peace.